Hey, 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 and welcome. I'm Dr. Lara Johnson from Yellow Brick Physical Therapy here in Boulder, Colorado, and welcome to another episode of SuperSoul Boulder, where we talk about all these things that are related to our mind, body, and heart health and wellness, right? I don't like to just stop there. Hey, Dan, great to see you. I don't like to just stop there at mind, body. I like to go beyond to mind, body, heart. As heart is in what lights you up? What are you passionate about? And what does you love to do? Carlos, hi. Hey guys, great to see you. Thanks for tuning in. All right, tonight's topic is, what a funny description that came to me during a run this morning. And it is, hey, thanks Dan. It is be like a tendon, a master transitioner. What do I mean by that? Well, tendon tissue, right? Tissue in the body. We got muscles, we got tendons, we got ligaments, and all sorts of other things. But tendon is a great transitioner. It is, you know, the kind of tissue, it's the tissue that goes between muscle and bone. If we didn't have tendon, which connects muscle to bone, we'd go from muscle straight to bone, which is like a super soft, squishy tissue, to a really hard bone, right? So it doesn't really work well. It'd be really susceptible to a problem. But tendon actually allows for muscle to transition to bone. And because tendon tissue, unlike muscle, which is soft, more soft and pliable, bone, which is hard and more sturdy and structural, tendon is a band of more dense connective tissue that allows for that transition to happen. And tendon actually can withstand a lot more loads and forces and provides a little more structure, but a little more give also. So it's this amazing transition, and our body's full of all these incredible transitions. Another one is the neuromuscular junction, where right where a nerve meets a muscle, there is an electrochemical occurrence that happens, and without that, a muscle wouldn't be able to respond or contract. So we have to have acetylcholine released from the nerve and create a cascade of events, including calcium released into the muscle to make it contract. So, but if there's a dysfunction or disruption in that junction, then that's where we can have a lot of problems. Same thing with the musculotendinous junction. We have a lot of problems right where the tissues meet. There's because they're different kinds of tissue, right? Where the muscle meets the tendon or the tendon meets the bone, there's a lot more dysfunction or disruption. Scott, great to see you. Potentially at where that tissue meets tissue, where muscle tissue meets tendon tissue, where tendon tissue meets bone tissue. That's where people can have a lot of tendinopathies or tendinitis or tendinosis. All those things can happen. But don't you think in your life there's also a lot of disruption or susceptibility that can happen at these transitions? I don't know about you guys, but I have been feeling like this is a time of transition. For one, at least here in Colorado, the last couple of weeks were smoky and full of fire, smoke, and particulates in the air. You know, we're transitioning from summer into fall. I can kind of feel it in the air. It was much cooler today. You might have, 20,000 people moving into your town because of a university, and that can feel like a transition too. And a lot of people are starting school, whether you're a student starting school or you're a parent and your kids are starting school. And during this pandemic issue where everything feels a little bit different or a lot different than usual, you might be feeling that the bigness of that transition. And so as I was just talking about how the tendons are so amazing because they have this, structural yet give kind of situation. They're pretty awesome. So we could be a little bit like that, a little bit flexible and a little bit tensile. Be amazing like a tendon. Bring out your tenacious tendinous qualities. Another kind of cool, I don't know if we could call it a transition. It's not so much a tissue transition in the body, but it's another T word. I've been liking T words today. And that's the tendonae cordae in the heart. So that's these little strings of tendons that allow for the valves in the heart to open. And so all these places in your body need to be just so in order to work with the other systems around it. So how in your life and in this time of transition or any time of transition can you allow yourself to be just so, right? A little bit flexible, a little bit with some tensile strength or whatever is needed right now. So another thing I was thinking about with this topic I'm losing track of what it was. What was it? So tendon, your tendinous, tenacious like qualities. Yeah, so anyway, I'm curious what you all are thinking, how that's hitting home. Do you feel more susceptible during these times of transition? I've been talking about this a little bit over the last weeks here. And it's not necessarily a matter of being stronger, right, or different. You wouldn't want to be too tensile, like the tendon. That wouldn't help with the transition. And you wouldn't want to be too flexible like the muscle, because that wouldn't allow for that transition either. But it kind of has to be just so. It's a little bit of Goldilocks I'm towing here in this. So being able to transition with that perfection of what's needed, right, is important. What am I thinking of? I've just lost the other topic I was going to bring up. So let me know what thoughts you have, what comments you have about that, transitions and the areas in your body that allow for that to happen. So often in our lives, we can, try to force or make something go a certain way. And it tends to come with limiting returns. And if we allow ourselves to be more like that tissue that needs to be in between, needs to be in that transition, maybe you feel sometimes like a transition point between people in your lives, allowing for some connection to occur through you. Or maybe there are other ways that you feel like you're a transition, or you notice these transitions. But as we go even from the pace of maybe summer and being more relaxed and being more, even with, that probably looks really different for different people at this particular year, but even with the vacations and camping and things, shifting to a more structured school approach, or you might even just feel it in the air as the different season. We want to roll with that. We want to go with that. We want to be like the tendon in its ability to kind of do what it's necessary, what it needs to do. We want to roll with that transition and not try to hold back or try to make ourselves keep from that happening. And we also don't want to go too fast into it. So you want to stay with yourself. Stay with what's happening. Because if we stay with what's happening in any given moment, you're much more able to ride with that transition. Dan asks, can you overstretch the tendon? Oh, great question. I love that question, because the way I see it, so like I said, the tendon is a more connective tissue kind of band of tissue, and where it's not as contractile or changeable as muscle. So in a sense, you can't really stretch a tendon at all. It's not really that stretchable. It's the muscle that's stretching. And because the muscle is connected to a bone through the tendon, it's really the muscle that you're stretching or not stretching. So you can but what you can do, if you overstretch the muscle and it doesn't have enough pliability, and then it's pulling on the bone, then you can get a lot of irritation on the tendon. And that's where you'll get inflammation, like tendonitis or tendinopathy. You get inflammation on the tendon if you're pulling too hard on a tendon that doesn't have enough give from the muscle. Does that make sense? So you don't want, it's another good reason to not overstretch in general, as in not pulling too hard. You want to understretch or back off of it, or make sure your muscle can both strengthen and contract, and also relax and expand. It's more about the muscle than it is about the tendon. Tendon's just connecting the muscle to the bone. That's the way I see it. Because once again, if we think about how a nerve tells a muscle to pull a bone, and we need nerve connectivity to the muscle in order for muscle to both contract and relax and expand, then the tendon's really not so much a part of that. In fact, tendon tissue is less changeable over time than a lot of other tissues in the body. So as someone ages, the kind of tissue, this was the point that was brought up in a clinical conference that I went to not too long ago, and the tendon in older adults isn't as changed as the other tissue in the body. So it's not as changeable. So it's really not it's just that it's not as changeable. But to my point about the way we want to be in terms of life and transitions, we want to be a little bit changeable and be able to develop over time, right? So in that aspect of the tendon, we want to be able to not just play our role the whole time, but also be able to develop, right? And grow. But because it's not so changeable, because it can withstand more tensile forces, it's not the thing that's going to get as disrupted as where it's pulling on the bone at the end of it, or at the junction between the muscle and tendon. Would a good example be plantar fasciitis? Plantar fasciitis tends to stem from, it goes along a lot of times with Achilles tendonitis, because a lot of people who have the same issue, think more up top, hip and pelvis, if they're more restricted in their hip and pelvis, they're going to land differently, more on the outside of the foot, because we need to have more openness here. If you don't have openness there, then you're going to land more on the outside of the heel, roll inward, create more tension and stress both on the Achilles tendon potentially, or the plantar fascia on the bottom of the foot. Now, if you're irritating the plantar fascia on the bottom of the foot, again, it's being irritated, not so much like it's fascia, so it's not stretching like a muscle. It's getting irritated because there's more pressure on it all the time from all the steps you're taking, or all the weight you're bearing on it in a less than optimal way. So it's already tense and taut, or, well, I don't know if it's already tense. It's just more that your leg is more restricted from your hip and pelvis, or your nerve cannot get all the way down to the foot to allow the calf muscle and other muscles around the foot to release. And now the plantar fascia is getting irritated, and because you're landing so often and creating more tensile forces on it than it can withstand, it's getting irritated. So that's what happens with plantar fasciitis. And that's why it doesn't resolve as quickly if you just roll under the foot or stretch the calf, as if you deal with the neuromuscular aspect up higher, where all the nerves branch out of the spinal cord and control all the muscles in the low back and down the leg all the way to the foot. So when I start there with someone, and not only just treat the symptoms around the foot and the ankle and the lower leg, but also where the source of the problem is, we get results a lot more quickly than we do if someone's just rolling their foot on a ball or just massaging that plantar fascia. Because we always want to go back to this. Why is it occurring that way in the first place? Why is the plantar fascia getting irritated? Why is the bottom of the foot getting irritated in the first place? It's not so much just that it's inflamed on its own. It's because extra pressure is being placed on it over and over again because of how you're standing, how you're walking, how you're running, how you're holding yourself. And that usually stems back up to your posture and hips and back, especially because of the nerves that control that area, especially because every time you stand or sit, your foot is in direct relationship to your hips. So if your hip rolls inward, your knee, if your hip is tight from the muscles that cross it, like the psoas and iliacus, your leg's going to roll inward. We tend to compensate by walking more on the outside of the foot, and then there's more pronation because the foot has to roll inward at a greater distance. And so it's going to overwork and irritate the plantar fascia, and oftentimes the Achilles. It can present in a couple of different ways. So the presentation can vary from person to person, but the source of the problem can be very similar. It's just occurring because of the varying forces or body positions or prior injuries or all the history that someone's coming with. Does that make sense, Dan? I hope so. Nerd alert, here I am talking excitedly about tendon and injuries and not so much to our point about tendon. But I love talking about tendon tissue. It's very interesting, right? It's easy to think about the bone, and a lot of people feel like, and hear the word tendonitis get thrown around a lot. That's okay, but remember, itis just means inflammation, so it really means inflammation of a tendon. Plantar fasciitis, Achilles tendonitis, other tendinitises in the body. Another cool place that I would point out is the transition are the intervertebral discs of the spine. So they're the biggest shock absorbers of your body, and they lie in between all the vertebrae bones of your spine. And I think of it like a transition because they also have this cool ability. It's not like a tendon where they're transitioning between two tissues, but they're between each bone, right? So you kind of have this hard but giving disc in between in between a more solid bone on the other side. And then we have this whole chain of that and these articulations of this chain. So now your spine can bend and move, but it can also withstand a lot of force and pressure of gravity, of walking, of impacting the ground, of running. And without those intervertebral discs, we'd be jamming into the ground a lot more and feel a lot more force displacement. But the same thing can happen when things go wrong, not just go wrong with the discs, but when your spine gets more compressed, so it doesn't have its spring load anymore. The spine is a spring load. The spine loses its spring load and becomes more compressed. Then it's pressing on those discs, and it's like a clamp on the front and a clamp on the back, and now you don't have that shock absorption potential that those discs provide for you. And so those discs become this really important transition. And if we take away their main capacity as a shock absorber and allowing the spring load of the spine to happen, why does it get taken away? Because the muscles on the front get short and tight, and it creates a clamp. Muscles on the back get short and tight, and now we have all this compression on the spine. If we take those discs away, if we take the ability of those discs, cushions, to have that shock absorbing potential away, then we run into a lot of other problems too. Problems like disc herniations or problems of the other joints, knee, foot, ankle. So we don't have that shock absorption. You could feel like you're pounding more into the ground when you walk or when you run. And so we need that transition of the body too to help do its job, to be able to be both flexible and dense, to be able to withstand all these forces. So in that way, the discs are kind of like the tendon, where it's withstanding more tensile forces, but whereas the tendon can withstand more tensile forces this way, the discs are withstanding more compressive forces. So how does this relate to our lives? That's a good question. Maybe one of the good questions of how this relates to our lives is, how can we withstand both tensile forces that are pulling us away, maybe all over the place, in this transition into the fall, and with more, 20,000 students moving into town for the university, all these things happening, pace speeding up, I can feel it all. It's easy to feel pulled away. So how can we withstand these tensile forces? How can we withstand the compression forces, the pressure on us to do things to keep up with, or whatever pressures are going on? Another thing about being like the tendon and being master transitioners is if you're transitioning either from an injury that you've had, or sometimes to an injury, helps to be with that transition rather than rushing it or thinking it should be some other way. That creates a lot more suffering and a lot more susceptibility, just like that musculotendinous junction. Just like we can be more at the junction where the muscle meets the tendon or the tendon meets the bone, we can have a lot more susceptibility to feelings of anxiety or of illness or of injury if we're not moving through that transition very gracefully. And it's easy to get pulled around. Again, so that's where those pressures relate. If we have those tensile pressures on us in our life, pulling us apart and all over the place, or the compression forces on us to do more or better or whatever that looks like for you. So the pressure, compression, what's holding you in, what's pressuring you, what's making you feel maybe stuck or too rigid. And what's pulling you apart, like you've got to go and do a bunch of things. It could look any of those ways. So withstanding those pressures and forces requires some strength. And I'd say moving through it gracefully requires a degree of flexibility or pliability, going with that transition rather than resisting it. You guys will have to let me know how this is landing for you today. So as you go about the transition into fall or whatever season it is, could be a season in your life that's not so much related to the seasons, but more like your seasons in your life, going through different motions, transitions, births, deaths, injuries, illnesses, coming out of that. Being able to take that as gradually as possible helps with the decrease susceptibility, kind of like a tissue transition from muscle to tendon, being gradual and not rushed. Does that make sense? Gradual and not rushed. We wouldn't want to go straight from muscle to bone. We're going to be really susceptible. We wouldn't want to go straight from muscles to tendon, because it would just, it's a place for tearing. That's what I mean by susceptibility there, for things breaking or becoming injured or coming apart. And so if you can transition, say, out of an injury, I see this all the time with patients. So, or one patient I saw today is ready to like get back to things, right? Get back to running, get back to more activity. But if we progress too quickly, we could set things back. You're more susceptible when you're trying to heal something that's been injured. So we want to be gradual. We want to take that in stride. We want to have a go-between. We want to have tissue from one side meeting tissue from the other side. We want to have, the healing process meeting the increase in activity in a gradual way, so that then you can best withstand both the compression forces and the tensile forces, or all the forces you're feeling on you. Both the maybe feeling anxiety or like wanting to get back out there, but also not, needing to hold back, or making sure that you're doing it in a healthy way. So my invitation to you for this week is to pay attention to where in your life are you transitioning well, or how hard might it be to do so, and where can you transition gradually and with the flow of all the pressures and tensions that are going on. And in that way be like a tendon that can both withstand the forces and pressures, the tensile forces, and can be a little bit have some give to it. Or like the discs of the spine, have some compression give to it, right? Withstand the compression forces. Have some give to the pressures you're feeling, both tensile and compression, and see how you can transition gradually, like muscle into tendon and tendon into bone, so that you're not pulling on one end or the other and creating an injury or illness or a disruption. See if you can stay with that. All right, thank you all so much for joining. It's such a pleasure and joy. I love seeing you all here. And let me know what questions you have. Let me know you're here by liking or hearting this if you're watching. And let me know what questions or comments you have, or what you're interested in discussing. Have a great week, and I'll see you next Monday for another episode of SuperSoul Boulder. I plan to be here for Labor Day. If not, I'll let you know. So take care and see you then. Bye. Thanks, Carlos. Thanks, Dan. Thanks, Chad.